Hi, Dr. Baumholtz, Baumholtz Plastic Surgery, 210-920-2390. And today we're going to talk about dorsal, that is back of the hand rejuvenation. And I've got another candidate to show some differences in how we use this. This is a 62-year-old woman who doesn't like the way the back of her hand looks. And we use a branded product, Radius. Radius has a lot of great uses. One of the best ones is dorsal hand rejuvenation. And I'm going to show you how we use it here at Baumholtz Plastic Surgery. To begin, we take the branded product, we mix it with a certain amount of numbing medicine so it's all factored into one set, and when I get it to the consistency that I'm happy with, I then get ready to do the injection. And the injection I'm going to show you is really straightforward. Now, typically we start off with 1 syringe per hand per treatment. Oftentimes people will need 2, even 3 syringes per treatment, but to make sure that we're giving you what you want, we'll do 1 at a time, and we'll have you back at about weekly intervals until we get you where we want you, or where you want to be, I should say. All right, so we're going to look at the back of the hand, and I'm going to just use some alcohol solution to prep things. And what we're going to focus on is putting the medicine in the intermetacarpal spaces, that is, the spaces between the fingers that over time lose volume and show our age. So I'm going to begin, and we're going to work from this way to this way. And here what we do is I'm going to lift up the skin. Are we ready? We're good? Okay, here we go. 1, 2, 5. All right, now I'm going to deploy some of the medicine into this space, and we're going to work distally. That's a tiny, tiny little syringe. And I'm going to make sure that I'm not in a tendon or a blood vessel. And it's really easy to do because you lift up the skin where there's a lot of room. You put the needle in, you wiggle it to make sure that nothing's getting stuck, and you put it in. Really very easy. Okay, we're almost done. You're doing okay?
Yep.
Perfect. Okay, again, I'm going to tent up the skin. I'm going to put it in, and I'm going to deploy a little more of the medicine. Make sure I'm not stuck in anything. And then here we are at the first space, and then we're going to put a little more on this side. I'm going to lift up. I got a nice place to put it, and I'm going to put this medicine in. You're doing okay?
Yes, sir.
Great. All right, next. I'm going to take my needle out. I'm going to put it to the side, and I'm going to take just a little bit of ointment, and I'm going to use this ointment, and I'm going to massage the product from distal to proximal in a very gentle way, okay? And so that whole thing took us, I bet, under a minute or so, and we're just about done over here, but there's one more really important step, and that is I'm going to take this towel, and I'm going to fold it up over top, and I'm going to have her just sit on her hand for a few minutes while we go to the other side. Okay, well, that's dorsal hand rejuvenation in a 62-year-old. I'm Dr. Baumholtz, a board-certified plastic surgeon. Come learn more about it at our practice, baumholtzplasticsurgery.com or 210-920-2390. Talk to you soon. Thanks.